But first, the White House Coronavirus Task Force delivering updates on the vaccine rollout, stymied a bit by that storm that rocked the Midwest. Yet vaccination rates are still climbing steadily, with about 12% of Americans having already gotten their first dose. And joining us to break that down is our guest here, Dr. Shereef Elnahal, University Hospital CEO and former New Jersey Department of Health Commissioner as well, joins us now. And Doctor, glad to have you back on with us. Just curious to get your take on what we're hearing of the timeline and rollout, where we're expected to see kind of this return to normal based off the vaccinations we've seen thus far. What's your take on that?
Well, thank you for having me. Despite the difficulties with the weather, which we've experienced here in New Jersey, but also across the country in places that weren't expected, of course, in Texas and other areas, we still are on pace. So we're still at about 1.3 million vaccinations per day. And while 12% is still a far cry from the herd immunity threshold of 70 to 80%, we're almost at President Biden's 1.5 million vaccination per day goal already. And the 100 million vaccinations in 100 days, I think, will certainly be met. I will tell you the vaccination sites are getting better at administering, more efficient, but also you see a lot of doses that were previously reserved for long-term care or pharmacies being harvested, those that were not used because they were not using them efficiently in some places, being harvested by states to re-administer to folks at these vaccination sites. So all of that is helping with the pace of vaccination.
We're also learning a lot more about the vaccines themselves. This latest data coming from Pfizer and BioNTech about their vaccine, that one dose can, in fact, be as much as 85% effective. Does that change the strategy, you think, around vaccine distribution at a time when there's so much concern about the ability to build up supply to inoculate the entire population here in the U.S.?
Well, I'll say this, absent a full review of that data from the CDC, but also having Dr. Fauci at NIH weigh in, I would still stick with the two-shot regimen for Moderna and Pfizer. And that's because the clinical trials really showed the extremely favorable results against that regimen. And we need to make sure that we try to adhere to the trials as much as possible. I will say, though, that the Johnson & Johnson vaccine is on the horizon, very likely to get an emergency use authorization from the FDA soon. And after that, we will have a explicitly studied one-shot regimen that is just as effective as preventing hospitalizations and deaths for the two-shot regimen, which should be used as much as possible and will only help with the pace of vaccination. So I'm very much looking forward to that.
Yeah, and the other piece of, effectiveness around these vaccines has been the question of spread. A new study out from Israel kind of highlighting that Pfizer shot is pretty effective in reducing the viral load, fourfold reduction in one of these non-peer-reviewed studies that points that out. How important is that? Because we already are seeing cases come down, and a lot of people are asking how much of that is a result of 12% of Americans getting their first dose, and how much of it is just kind of, weather changing or the idea that, people are taking this a little bit more seriously. I mean, how optimistic are you that data point actually shows that this recovery into the spring and summer might actually be stronger than people expect?
Well, we should all be happy that the pace of reduction in cases is happening to the extent that it is. And unfortunately, the variants do add a variable that will potentially make that, short-lived and possibly turn things around for the worst. But we don't know that yet, and we do know that we're decreasing. So something is happening right. I would be careful, though, of ascribing that to vaccination. 12% is, again, a far cry. And we saw from data out of Israel, which is by far the number one country in the pace of its vaccination, we really started to see cases drop much more precipitously when you start to get to that 40-ish% range of the population vaccinated. And they're well on their way to getting well past 70 to 80% very soon. So we do know, though, that as long as we increase the pace of vaccinations, if we get to that 1.5 million vaccinations per day, that is the most important determinant of return to normalcy and the easing of many other restrictions. And we're already starting to see, for example, the CDC remove the quarantine requirement, even if you're exposed, if you have gotten vaccinated. And you should expect the CDC to add even more latitude to vaccinated folks in the coming weeks to months.
On the local level, we have seen a number of states now move to lift the mandates for mask wearing, as well as restrictions on social gathering. Iowa, the very latest here. Are we at that stage right now in the pandemic? If you look at some of these states that have moved in that direction, have things quieted down enough to allow for the lifting of face coverings?
Well, I would be very cautious about going too extreme in terms of easing the restrictions. We really need to be careful. Remember, the entire country saw a pretty precipitous drop in cases towards the end of the spring of 2020, only to see sharp increases again in the middle of the summer in many parts of the country because there was a little bit too fast of an easing of restrictions. And so we don't want to be caught in that scenario again, especially as we see so much hope with these vaccinations. We really should wait for the herd immunity effects to be noted clinically and to be noted in the data before we start doing that. So that would be my cautious advice to states that are considering doing that.
All right. Appreciate you bringing us the latest on all of that. A lot of topics we got into there, but appreciate it. University Hospital CEO and former New Jersey Department of Health Commissioner, Dr. Shereef Elnahal. Thanks again. Have a great weekend.